Sepsis is one of the most life-threatening conditions you'll encounter as a nurse. And it's also one of the most important to recognize early. But a lot of nursing students struggle with three things: what sepsis actually is, why patients decline so fast, and what nurses should do first. So today, I'm going to break it down step by step. We're going to cover what causes sepsis, the warning signs, septic shock, nursing priorities, and the critical NCLEX concepts you'll absolutely need to know. If that sounds helpful, make sure you subscribe and let's get into it. So first, what exactly is sepsis? Sepsis is the body's overwhelming and dangerous response to an infection. The problem isn't just the infection itself. The real problem is that the immune system starts overreacting in a way that damages the body's own tissues and organs. That's why sepsis can become life-threatening so quickly. Here's a simple way to think about it. Imagine a kitchen fire breaks out in a home. Normally, firefighters come in and control the fire. But in sepsis, it's almost as if firefighters panic and flood the entire house with water, causing destruction everywhere. That's what happens during sepsis. The immune system's response becomes dysregulated, and it starts damaging blood vessels, tissues, and organs throughout the body. So what exactly causes sepsis? Sepsis usually starts with an infection. Common infections that can lead to sepsis include pneumonia, urinary tract infections, abdominal infections, infected wounds, bloodstream infections, and sometimes severe viral illnesses. Anyone can develop sepsis, but higher risk groups include older adults, immunocompromised patients, surgical patients, patients with chronic illnesses, and very young children. Here's an important nursing point. A patient may initially appear only mildly ill, but sepsis can worsen very quickly. This is why early recognition is so critical and why nurses are often first to catch the warning signs. So let's talk about those warning signs. A patient with sepsis may develop fever, chills, tachycardia, which is a rapid heart rate, tachypnea, which is rapid breathing, and hypotension, which is low blood pressure. You may also see altered mental status, decreased urinary output, weakness, confusion, and low oxygen levels. On the topic of urinary output, normal is 30 cc's per hour. Anything less than 30 cc's per hour tells you the kidneys are not being adequately perfused. Now, here's one of the biggest NCLEX concepts when it comes to sepsis. Mental status changes. If a patient suddenly becomes confused, restless, lethargic, or difficult to arouse, especially in the setting of an infection, think sepsis. So why does blood pressure drop? During sepsis, blood vessels become leaky and dilated. This causes fluid to shift out of the bloodstream and into the tissues. As a result, blood pressure drops. Organs receive less oxygen and perfusion, meaning blood flow decreases. This is exactly why sepsis can progress into septic shock. So what is septic shock? Septic shock is a severe progression of sepsis. In septic shock, blood pressure remains dangerously low, even after fluid replacement, and organs begin failing from poor perfusion. This is a medical emergency. Patients may develop severe hypotension, mottled skin, which is red and purple patchy skin that signals poor circulation. There may also be confusion, elevated lactate levels, decreased urinary output, and respiratory distress. Without rapid treatment, septic shock can become fatal. Let's talk about lactate because nursing students are frequently tested on this. When tissues aren't receiving enough oxygen, cells will shift from aerobic metabolism to anaerobic metabolism, which is metabolism without oxygen. That process produces lactate. So elevated lactate levels are a sign of poor tissue perfusion. Here's an NCLEX tip. High lactate in a sepsis patient usually means oxygen is not being delivered to the tissues effectively. Keep that in mind. Now let's get to the most important part. What should the nurse do? Your priority nursing actions include recognizing sepsis early, monitoring vital signs closely, obtaining blood cultures, administering broad spectrum antibiotics quickly, starting IV fluids, monitoring urinary output, administering oxygen if needed, and reassessing for signs of deterioration. Early antibiotic administration is a major nursing priority. The faster sepsis is treated, the better the patient's chances of survival. Fluid resuscitation is also critical because patients become hypotensive from widespread vasodilation and fluid shifting. And as you're monitoring, watch closely for worsening hypotension, decreased urinary output, again, less than 30 cc's per hour, means the kidneys are not being adequately perfused. And ask yourself why. Because when blood pressure drops, blood flow to the kidneys drops with it. Also monitor for altered mental status, respiratory distress, rising lactate levels, and any signs of organ dysfunction. Let's apply this with a quick case study. A 72-year-old patient with pneumonia suddenly becomes confused, tachycardic, and severely hypotensive. Blood pressure less than 90/60. Their respiratory rate is greater than 20, and their lactate level is elevated. What should the nurse recognize? The patient may be developing sepsis with poor tissue perfusion. Priority actions include notifying the healthcare provider, initiate the sepsis protocol, obtain blood cultures, administer IV fluids and antibiotics, and monitor closely for progression to septic shock. Let's do a quick recap before we wrap up. Sepsis is a dangerous response to infection. It can quickly become life-threatening. It causes widespread inflammation and poor perfusion, and it requires early recognition and fast treatment. Your key nursing priorities are early identification, antibiotics, IV fluids, monitoring perfusion, and ongoing reassessment. Nurses play a critical role in catching sepsis early, and that early action saves lives. Thanks for watching, and I'll see you in the next one.